tuning into the second session of Aspire Day. So I have the pleasure of introducing Dr. ChrisAustin, who's the CEO partner at Flagship Engineering in Cambridge, Massachusetts. He is going to serve as the CEO of one of their franchise companies. And before that, as you may know, he served as the director of NCATS for 10 years. Prior to NCATS, he was at Merck. And before that, he graduated from Princeton with his BA in biology, and then went on to train in internal medicine and neurology at the second best hospital in the Boston area, Mass General. That's, of course, second to Brigham. With that, I will turn it over to Chris.
Thank you, Jamie, I think. It's great to see everybody, and yeah, I miss you all. But I was really pleased, and I'm just going to share my screen here, of course. Where am I? Yeah, I'm going to share my screen. Started here. Yeah, there we go.
Looks good.
And I was pleased that Jamie, the organizers, were willing to have me come back for a cameo appearance or an encore performance, whatever the term is, because this is a project that is very near and dear to my heart. Those of you who know the history of Aspire know that this was and is one of my signature initiatives when I was NCATS director, and so I was asked to just give the historical background, really, of why we thought of this idea in the first place. And the other thing to say is that though I've left NIH, my new work at Flagship, it won't surprise a lot of you to learn, is highly related to the work we all did together at NCATS. And one of the things one of the reasons that I decided to make that move was really the third D that the NCATS always talks about, the develop, demonstrate, and disseminate, that this needs to be not only a partnership with, but dissemination to the private sector. And it already is that in some way, but it's just getting started. And so I hope that I can play some role in that. So what this funny title is. The way Flagship works is it's a large a firm, has about 40 companies in it. The one that you probably all heard of is Moderna, but there's many others. And so I'm a partner in that firm, but I'm also the CEO of a new company, which is actually still in stealth. So we're not even talking about it yet, but it's a very exciting opportunity, which I look forward to telling you all about when I can, which will be later this summer, I think. So let's just dive right in. So this is the problem that one of the problems that we who work in the translational space run into all the time. That is that though it is now almost 20 years since the official completion of the Human Genome Project, which of course was April 15th, 2003, so a little over 18 years ago, surprisingly little headway has been made in exploring novel chemical space to pharmacologically modulate all the targets in the genome. And when the genome was finished, that was an explicit goal. We developed a lot of tools to manipulate the gene at every gene at the gene level, the locus level, and that's in the mRNA level, and those are wonderful. But of course, Mother Nature does most of her work at the protein level, and so we knew from the very beginning that pharmacological probes were going to be essential to understand what the genome did for a living and its pieces. Of course, an exceedingly more complicated problem than developing a PCR primer against a gene, because the physical chemical interactions between small molecules and their protein targets or other targets, lipids or others, are orders of magnitude more complicated than the Watson-Crick base pairing that typically modulates or mediates DNA or RNA interactions. And some efforts, including those of us at NCATS, when we were still back at NHGRI, went to that, and the early translation branch still at NCATS does that, and a few others. But it's surprisingly little headway has been made, such that you've probably all seen this really quite striking figure from Tudor Prea's paper from that's a derivative of another project that NCATS was involved with and still is, called the Illuminating the Druggable Genome Program. And so have a look at this paper if you haven't. And if you look at the cadence of discovery, it's surprisingly low. One would expect a lot more headway to be made, but it really isn't. And probably one of the reasons for that we've known for a long time, which is that if you're going to explore novel genome space, you're very frequently going to have to get into novel chemical space. And of course, extant chemical libraries they're a historical artifact, at least in pharma, of the projects that the pharma companies have done over the years, and the available chemical libraries from commercial suppliers to some degree derive from that historical experience. Partially because they wanted to make libraries that would be of interest to others, and so they copied what pharma did, but also because the pharma work established the synthetic routes to make the compounds in the first place. And so they were synthesizable, and so they were the ones that the commercial suppliers now use. Now, of course, we could take a detour into combinatorial chemistry, diversity-oriented synthesis, split pool, all of that stuff. I think we know the history of that. Wonderful techniques, but just didn't work out as we had hoped, and for really understandable reasons, though the science was very good. So the question that we had was this one, right after we at NCATS, or what's now NCATS, started back in 2004. This paper, remarkable timing, appeared in Nature. There was a special issue called an insight issue on chemical space, and I like this this initial quote. I don't know if you can see it. Space is big. You just won't believe how vastly, hugely, mind-bogglingly big it is. And one could say that about astronomical space, but I hope, as we all know on this call, a small molecule chemical space is essentially infinite. I mean, functionally infinite, 10 to the 60 molecules, or whatever number you prefer. And one of the most interesting, I think, questions for all of life science and chemical science is, what is the portion of chemical space, the minimum portion that you need, the minimal set that you need to cover all of biological space, right? So that was the fundamental science question, because if we could answer that question, it would not only be practically incredibly useful, so that if somebody came to you with a novel target, you could say, oh, I know what that is. I can predict it, and I'll pull it out of the freezer. I know I can synthesize it. I might even have some here for you. But also, it would tell us, and that would have not only fundamental science, but also therapeutic applications, obviously. But it would also be a truly epical scientific achievement to understand what those rules are. what the match between chemical and biological space is and what those rules are. And so we started even back in the dark ages before Aspire, working on, we and others, we're certainly not the only people doing this, trying to use what we then thought was big data in 2017. And of course, big data gets a log bigger every year. So, big data in 2017 would probably be small data now. But the question is really here, machine learning, big data, helping chemists search the vast chemical universe for better medicines. Now, that's a simplification in a lot of ways, right? Because there's a lot of steps in between. But really, that's the major motivating force for Aspire as well. So in 2017, again by remarkable happenstance, at the same time as this paper came out in Nature, we had a workshop, and we got a whole bunch of people together. It was really a remarkable workshop. If you haven't read the summary that came out of it, people from the public sector, the private sector, scientific journals, people, very diverse individuals who often did not agree. And we set up the workshop that way on purpose. We wanted to have a robust dialogue with the question was, do we have the tools now to envision a world where we could create a unified system of chemical design, synthesis, purification, testing, and reiterative learning of what structures work against what biological targets in a way that would be automated and one day perhaps even autonomous. And so this was the slide I used to introduce that meeting. The chemical structure is vast. We've gone into that. Biological space is, is not chicken feed, but it's teeny by comparison. 5 times 10 to the 5, maybe 10 to the 6, depending on what you include. And as we said at the beginning, 90% of it is currently undrugged. And this challenge to identify new chemical space is an absolutely core translational challenge for drug discovery and development. We are never going to get to where we want to go in this state of affairs. So you'd say, well, how are we doing? How much have we done? Well, not too good. Part of it is the scale of the problem, right? But part of it is we just have not had breakthrough high throughput chemistry developments, technologies, the way has happened in my professional lifetime in biology and in informatics and in engineering. And so all of us who are in this field know that chemistry lab beyond a point looks very much like it did when I was in high school, and they are completely outgunned by the biologists who are running their reactions in 1536 well plates and running 3 million a week. And the informatics people don't even get me started. They think in the millions or billions or even more molecules. So we really thought we've always wanted to have chemistry be able to be an equal partner in its throughput. It really needs to be. And we realized that besides a very narrow reaction toolkit, relatively small group of reactions that are used over and over again, and that's not all bad. It can do a lot of different things. We needed additional chemistry-related solutions related to how to predict chemical reactions a priori. How do we predict chemicals that will modulate any desired target ab initio, even without things like docking, virtual screening, which is around now. And then the ability to produce those molecules cheaply and rapidly. So we had a hypothesis that this might be addressable by combining automation engineering, synthetic chemistry, biological screening, and deep learning as it existed in 2017. And it was a real aspiration. I think you can all agree, even today, but particularly in 2017. And that's why the name of this program is so fitting, Aspire. So this is a slide that some of you probably maybe show, but I wanted to kind of put a fine point on this in the last 100 years, not to embarrass Alex and the other chemists, but just to state the world that we live in. You know, that in the last 100 years, we look at the 4 fields which translational sciences work in, biology, informatics, engineering, and chemistry. If we look in 1917, so this was a slide I made in 2017, so it hadn't changed very much since then. Biology looked like this. You had people, and this is pretty much what my high school biology lab looked like. And informatics looked like this. This was, a lab notebook, and engineering looked like this. It was very, very rudimentary. And chemistry, I love this one. This is actually the first picture that came up on Google when I Googled chemistry in 1917. Was a chemist mouth pipetting something that's probably toluene or something awful. Happily, we don't do that anymore, but for the most part, things in that space may not have changed very much. So 2017, you look at biology, this is what it looks like. This is one of the folks at NCAT's, Yachin Zhang, using a plate reader with a 1536 well plate. Informatics, of course, looks like this. Engineering looks like this. But chemistry looks like this. Now, except for the fact that the PPE has changed and the chemist is not mouth pipetting, really it hasn't changed that much. We're still dealing with instead of Bunsen burners, we have hot plates, but we still have round bottom flasks, just like we did back in 1917. So, and this is not for lack of intelligence or trying. It's just a really, really, really hard problem. And so we put a marker paper together back in 2019. I hope you've all read. And I just want to read this to you because it really still motivates the project to this day. That Aspire aims to address 2 challenges in the current era of biomedical research. One is to harness new technologies to accelerate understanding of living systems and to fulfill the promise of science to improve the lives of the many patients, the majority of diseases with untreatable, that are untreatable or poorly treatable. And those were the 2 goals of the program and still are. But we also wanted to explicitly state that we view this as a very important, I'll use an overused term, Sputnik moment for chemistry. That is, we really think that this can and should reinvigorate and integrate the disciplines of chemistry into the biological sciences. So much like other types of space exploration, which in my era, I mean, I was 9 years old when the moon landing happened, and that was formative for everyone in my era. Aspire is a similarly ambitious vision that we hope will spawn new technologies. It already has, excite a generation of aspiring scientists to produce solutions that have been heretofore intractable in science and medicine. So I'm just going to end with this because this is really the point of Aspire for all of us, and the real point is the heartbreaking discontinuity or difference between the yellow bar and the red bar at the far right in 2020. This is a slide that shows a number of Mendelian diseases in OMIM that have a molecular basis that's understood. It's almost 7,000, but if you look at the number of treatments, it's about 500. And at the current rate, it will be 2,000 years before every one of these is treatable. And the problem that Aspire aims to solve is fundamental to changing this reality for millions of patients who are waiting. So the work that you are doing, that we are doing together, could not have greater importance technologically, scientifically, aspirationally, or medically, and means a great deal to patients that none of us will ever meet. So I look forward to following the day as much as I can, and certainly will look forward to following the program as it proceeds over the next many years. So thank you, Jamie.
Thank you so much, Chris, for giving these talks and for really laying the groundwork for Aspire. And we hope to live up to these expectations.